My name is Jen Lunsford. I'm a state assembly member in New York, and I'm standing here in a hallway of the Capitol building to talk to you a little bit about this so-called big, beautiful bill that Congress has passed. You know, putting aside the fact that this bill literally takes food out of the mouths of children and knocks pregnant women and babies off their healthcare benefits and kicks elderly people out of nursing homes, the economic impacts of this monstrous bill will be felt by every single person in this country. Healthcare is an ecosystem, and the scope of the cuts this bill implements won't just affect the working poor, which is what most people think of when they think of Medicaid, right? When people are sick or injured, they go to the hospital, and the hospital treats them. That's actually the law. They're required to treat people who show up at the hospital, whether they're insured or not. And when hospitals aren't paid, what do? They have to then bill those patients. Most of those patients can't afford those bills, so then what happens? The hospitals eat those costs. And with so many of our hospitals, especially upstate, already distressed, already operating on razor-thin margins, that will be disastrous. It will literally shutter emergency departments, close operating rooms, and flood regional trauma centers like Strong Memorial Hospital in Monroe County. That means that when you and your Medicare or your private employer health insurance show up with a heart attack or a stroke, or you need a hip replacement that gets scheduled out, there won't be room for you. Costs will be higher, and delays will prevent people from accessing care before disaster strikes, which means that when they do go to the hospital, their outcome will be worse and it will cost more. This bill, which cuts over $13 billion of Medicaid just from New York State, a donor state, mind you, will throw the entire country into a recession. Medicaid doesn't just pay for care, it funds salaries for workers in industries that are already struggling to maintain staff levels. We're going to start losing direct care providers from group homes, from nursing homes, from home health care, because they can go to Burger King and make more money. And the majority of people who work in those positions are single-family head households. What's that going to do to the working poor? You know, this bill, which cuts health care and nutrition benefits from hardworking families to provide tax cuts to the rich and drives our deficit up trillions of dollars, will have far-reaching effects that impact every single person in New York State. Every member of Congress who voted for this bill should be ashamed of themselves. Join me in fighting back. Call on the U.S. Senate to protect Medicaid. Thank you.